Hi, I'm Dr. Steve Knighton. I'm a sports therapist and the chiropractor at Glen Abbey Physiotherapy in Oakville. Today we're going to talk about tendinitis and tendinosis. This is a big problem in the medical community we find right now. A lot of medical doctors are diagnosing something like tendinitis or tendinosis via an ultrasound, which is perfectly cool and it comes out. The problem is a lot of them don't know how to differentiate between the two. Tendinitis, which I'm sure most of you have heard of, is actually the swelling or inflammation of a tendon. It can happen from overuse, from slipping and falling, from a bunch of different things, but there's actually a style of inflammation there affecting the tendon. However, tendinosis is actually a cellular change in a process, such that it's not necessarily an aspect of inflammation, and in reality, there isn't any inflammation there. So patients can have this with a bicep, a shoulder, a quad. I'll give you an example of the shoulder. The supraspinatus is a tendon in the shoulder that we see it a lot of times. Tendinosis from just overworking it or something like that, where then there's swelling. Things like ice, the doctor may prescribe you naproxen or some other type of NSAIDs, which will actually help that and bring down the inflammation. However, if it is tendinosis, in all reality, ice and an NSAID would be kind of irrelevant because there is no swelling, and a lot of times you're doing more damage than good. So you just want to look on the board here. We're going to talk about tendinitis. So tendinitis, most people are familiar with that term, it's swelling. So we're going to say, here's the muscle belly, and then here's the tendon. What happens is the inflammation goes along this side here, and can kind of wrap around, causing pain, decrease of motion, and overall stiffness of the muscle, which can lead to stiffness of the joint. Tendinosis, however, is an actual cellular change. So there's the tendon there. What you'll see in the ultrasound is something like this. Now, these need to be treated two very different ways, and we'll speak about that next time. So if you do get an ultrasound and your doctor does diagnose you with tendinosis, so the osis is the cellular change, things like naproxen, Arthrotec, really those won't do anything because those are NSAIDs and they're non-steroid anti-inflammatories which decrease inflammation. So in essence, with something like tendinosis, it's just going to take a little bit more time, a little different treatment, but it is definitely a necessity to know into fixing us. So a lot of times here at Glen Abbey Physiotherapy, we have people come in who haven't seen very good treatment so far with this, and their program of care somewhere else is not getting where they want to go. 3 to 4 weeks in here, we actually have the diagnosis of tendinosis and they get a lot better.